Look where I'm at, hospital. And it's the last final conversation about me being in the hospital dealing with anything medical. See this thing right here? Flare it up. I think it's fluid right there. That's the only reason it got me in the hospital. Team scared to pull it off with a needle of infections, but I feel like that's still needed. Make me feel better, but besides the heart wise, any other organ in my body, I'm straight. I'm in the hospital. I don't even have a monitor hooked up on me or nothing. You know, this is protocol. Anybody go in emergency, they're gonna put an IV in you. This is where it get tricky now. Every human in the world that knows B know that I went through the heart problem and all that for a long time or whatever. But when you get to the point where you done basically did every possible procedure to get the heart fixed, went through any type of scenario, procedure. I had so many procedures, I can't even talk about it. You just think about what a heart patient is in the hospital if they're going through something in 2021, going into 22, needing. I done did it. Nothing I can talk, you can say dealing with anything medically for the upper body, lungs, heart, kidneys that I ain't experienced. I done did it, which it get to the point where you feel like it's over with by thinking that way, having to go through that. When I had my transplant last year and now I'm going into my second year, it's like getting to the point where it's more the minor little things like infections and bacteria and rejection is the number one concern, and I can give that credit to Dr. Raj, the whole Houston Methodist staff, when they told me for the rest of the life, Celsius, tacrolimus, prednisone at times will be your best friend, and a lot of other things as you carry yourself, it'll be better. But when they said the infection part, which I don't have no infection or nothing like that, but when you a transplant, they babysit you so much that you gotta go. Any little scenario can have you ending up in the hospital. Just an overnight day or whatever. And make sure you straight with the hospital situation, insurance and whatever, to be able to be in these type of institutions and able to be through the protocol where they have trust that you can come into the institution because you're doing your job right. You're doing whatever it takes. When they tell you to do something, you're doing it, and you find yourself not even feeling weird or going through something terrible. So on that note, I sit around and see how the teams come in, the new residents, the new nurses, uh, medical assistants, whoever just not joining the team over the last 5, 10 years, and when they come in, they like, well, let me ask you this question. Are you this? Are you that? This and that, man. Check my record. 25 years of this stuff, man. I done tried everything. I'm tired of answering questions, but I know I got to. Yeah. And I'll get intrigued by telling more. Basically, sometimes I be talking about stuff that they don't see the average patient talking about. I come at them with different theories, different ways, but I have my whole experience. So everything is backed up in one. But when I get to talking about anything dealing with the heart, or anything dealing with the kidney, anything medical, I can just even some of what I done been through and just shoot it out there. UT Southwest, take them for example. Infection doctor came in or whatever, dealing with, transplant, you gotta be cautious no matter what. And he was like, listen to me at the edge of the bed. He's a known doctor. Oh man, have you ever thought about being in medicine? What? I am the medicine. I'm patient, man. But hey, I thought about it, man. I know so much about this ways to go by in the procedure you're finna go into, what to look out for, and this and that, and know medicines now, names of top tier medicines, and know what they work for, what they're against, what not to do, what you shouldn't take if this number is high and stuff like that. Because I read my charts so much, and I'm like, man, that might be an avenue one day, eventually, soon. and I already got the time put in. You know, they always say it take 15 years to get this and that, 7 years to become this. I got 26 years plus now knowing medicine, medical procedures, everything, knowing what deepness of it just to go to. Because I've listened the whole time as I was going through procedures. I was asking questions. There's a ton of doctors could tell me. I asked, what you mean, Mr. Edward, let us do our job. I'm letting you do your job, sir. I'm just trying to figure out the whole concept of all this. And the number one thing to end this, I got to give a shout out to most of the cardiologists ever stepped forward in my life for keeping me to this point from 1997 to 2021 and beyond. Number one was the Charleston Methodist Hospital, Dallas, Texas, off Wheatland Road. And the whole staff, names I don't even know now. I remember me coming from transitioning from just doing what I was doing to not even worrying about medical, not even knowing about medical. But once I came into the hospital, I was like, man, what's going on? I got this little cold, man. I'm out here. It's Christmas done went by, 96, this and that. I need to get back, man. I go to the hospital, get a little cold medicine. There you go. You have the enlarged heart listed at the x-ray. I'm 23. What? Enlarged heart or whatever? CHF, man. I don't know what you're talking about. Try to go 8 months without even recognizing it hit me. But I give a shout out to Charles Methodist. They first one realized that I had the heart problem, caught the myopathy, whatever they called it, whatever they just say you have that. So on that note, I went to Parkland, emergency or whatever, because I was feeling messed up. And on that note, they did my back check on Wheeling. All the records showed that I had that. And every time the checks x-ray showed the big heart. So no matter where I was going from there, so Parkland, I got to give y'all a little this and that. But this wasn't too much to stay at Parkland. I didn't really want to stay at Parkland, but they did endure me to transition into the transplant. And that's where I want to give my thanks to some of the best cardiologists in the world, starting with number one, Clyde Yancey, Dr. Estep, Dr. Drasner, the UT Southwest staff, Dr. Markham. It's a few of them that I known back in the 2000s, early. I mean, it's a slew of doctors, and it's one. I think he went to the University of Duke. I wish I could have met him, whatever. But you never know where they at after 20-some years. I see that a lot of them look different. I'm back at UT Southwest now, and then that trip ended with all of the RNs I seen, the CNAs, the housekeeping at UT Southwest, the nurses, the medical assistants, the MPs, and everybody that was supporting me, financial counseling, the door desk representative, the phlebotomist pullers, everything at UT Southwest back in the 2000s. I want to get that dedication to that part of it. They all was playing their role in me getting to the point of getting transplanted. Then it moves over to the transition from that to going to Houston with the likes of meeting Jerry Estep, Dr. Bimaraj, Dr. Guhan, Dr. Trackenberg, some of the early ones, man. There's so many at Houston Methodist that I can state that I went through, and I had a time of my life for that 7 years down there in Houston, 7 to 8 years dealing with chasing a heart at the maxest period of any time, intense LVAD from 8/1/2013 all the way to 2/19/20 getting a heart, and it was a roller coaster. LVAD life was a roller coaster, but I rode that roller coaster through the ups and downs, going over the hill, down, going around. It was just like, it was meant for me to have a thrill-seeking adventure, led with a lot of, man, some massive surgery, some days when I was told it wouldn't be, you just got to go in there with prayer, call everybody, let them know, and this and that. But I got to give a super shout out to the Houston Methodist transplant program, heart and lung walk program, the whole LVAD coordinators, staffing, the RNs, the transplant coordinators, everybody that put this together. Dr. Loby, I got to give you a strongest shout out ever. The one that put the LVAD in me to the extreme. We, his assistants, it's a slew of them, medical assistants, Neil, LVAD coordinators, and all of the ones that was dealing with Neil. The 111, man, I gotta say, 111 was a venture of my life for 7 months. 2019, man, it was just the adventures out of this world. I saw so much being in the hospital, 7 months to transplant. The venture out of every possible aspect at 111. But on that note, man, I'm out of here, man. It's 2021, going to 2022. February, I'll be 2 weeks post. Hospital stays no longer needed no more. Y'all be blessed, man.